to speakers.
Dr. Matham, and many thanks for all presenters for their nice presentations. Actually, I have a question for every one of our colleagues. First, for Dr. Salman, as he said about the situational. You hear me, Dr. Salman?
Yes.
Yes.
It's a bit faint, but carry on. Yeah.
The future trends of leadership, the scope of review is about the situational leadership. Do you think the organizational and the structure of our health institutions in Iraq, except for such visions of leadership, and how do you evaluate this, the kind of the current leadership, health leadership in Iraq?
It's. I mean, thank you very much, Dr. Saad. Excellent, good questions, and very practical, and also sensitive, if I may say. I mean, first of all, it's unfortunately in many countries in the Middle East, this is not Iraq specific, that the leaders are not trained for the leadership role. I think Dr. Abdelamir quite rightly said, you may be born as a leader, but you cannot be a good leader unless you actually trained in leadership and organizational theories, etc. You need to understand what does it mean, health management and health system and how they work and the various components. Appointing a doctor to a leadership role is the system which exists in the Middle East, without any background. So situational leadership is once you are in a leadership role, each one adopt a style. And unfortunately, we looked at that in various studies, which some of it I'm involved in it, and we published it. When you look at situational leadership, because each one of us adopting style, we have a style of dictating, telling the people. I mean, this is very common style. The second style, leadership, which is really listening leadership and participating leadership, But generally speaking, we have to train in changing our style. And a good leader, he could direct in certain situation, i.e. telling the people, and this is the telling style. He could mix it with participation, listening to the team, listening to the people, because sometimes you miss certain things. And sometimes you have delegating the whole function to the people with expertise, which you have to trust all the people working with you. When we run leadership courses at Imperial College, my WHO center do that for the last 25 years. And from the Middle East region, we have a lot of courses for people from the Middle East region. We saw their style, they are unwilling to delegate, when we assess them and we assess their leadership style, almost everyone coming from the Middle East, they have zero. And by the way, the Chinese the same, which we found in different culture, people from China, people from South Asia, unlike the European and American, they do trust people and delegate. And when you ask them, why don't you delegate? They said, I don't trust people because people may stab me in the back. People may do this. People may do that without my authority. So the issue of authority, it is not shared. It is not linked. And therefore, we train people in these sort of situational leadership exercises that they need to identify what is the event that they are dealing with, what is the decision they are taking, and what is the need to bring all people together, and they change from one style to another. As I said, there are these four most common styles used in leadership.
Okay. Thank you so much, Dr. Salman. Dr. Saad, another question to
Dr. Abdelamir and one for Dr. Victor.
Okay, Dr. Abdelamir.
Dr. Abdelamir, thank you for your presentation. What are the scope of the future leadership as you see it, and what are the changes which has occurred in the leadership, health leadership within this century?
Thank you, Dr. Saad. I mentioned in my lecture, my talk about the changes that will suspected or expected in the future. From the condition we face it in the pandemic right now, a lot of things changes, even in medical care and in dealing with the patient. And as I know, a lot of research done in UK, and they see even survival rate is better when they communicate with the patient through electronic clinic. I think a lot of changes it will happen regarding medical education, regarding patient care, regarding even structure of the hospital. Everything will be digital. You may be you are at home and you do a surgery in UK or in US through robotic surgery. There is a revolution of electronic changes. Thank you.
Okay, thank you so much, Dr. Saad.
Short question for Dr. Hector. Thank you.
Okay, you have another question, Dr. Saad?
Yes, for Dr. Hector.
Okay, the last question, please.
It's time, Dr. Hector, do you think it is the time to adopt a module of health leadership to be distributed globally?
Yes, and actually I was just thinking about that as Dr. Amir was speaking, that healthcare now, as we know, is not just local and regional. Now it's worldwide. And as a result, we have to really focus on starting to train leaders in a worldwide basis. We have organizations like WHO, the United Nations, etc. But I think that we now formally have to really look upon developing leadership models, leadership modules that will address the healthcare concerns at a worldwide basis, which will involve a lot of collaboration, a lot of partnerships. But we need to start doing it because we realize now with this type of pandemic that we are no longer alone in our own countries. We're no longer alone in our own regions, and we're all brothers and sisters in the world, and we have to start taking that step forward.
Okay, thank you so much, Dr. Hector. Now, Dr. Afrouz, if you have any question, Dr. Afrouz. Dr. Afrouz. Dr. Afrouz. Dr. Afrouz.
You are muted. You are muted.
No, it's not me.
Is it?
No.
Dr. Afrouz? Okay. Dr. Mohammed Al-Ta'i, welcome, Dr. Mohammed.
Also muted.
Okay, no problem.
اهلا، السلام عليكم اخواني الاعزاء. اعتذاري عن تاخري بالحقيقه كنت بالطريق، مع الاعتذار الى الزملاء جميعا.
Okay, no problem. Welcome, Dr. Mohammed. I think it was really very informative talk and lectures to improve health leadership. We will meet you in next webinar with a new trending subject. See you and stay safe, please.
Thank you. Thank you.
Thank you.